Our club's always been a forum for visionaries, public figures, and decision makers to command attention to the issues of our time and inform the most relevant, compelling, and challenging conversations. Here we offer first-person access to dynamic political, business, and public personality.
The Canadian Club is one of the most important podiums anywhere in the world that a Canadian can speak to, tell Canadians what it is that they think, develop those thoughts. And so I want to thank you for that very, very much.
Please join me in thanking our esteemed panelists today.
Through our programs and events, including our youth and young leaders programs, our diversity partnerships, our joint events, and our media and social media opportunities, we offer you access to dynamic political, social, and business figures from abroad and right here at home.
The platform from which the eloquence of Canada has flowed all of that time, whether it be business, education, politics, sports, arts, and culture. If someone wants to say something to Canadians about this country and about the future of this country, this is the venue you choose.
All right, we're back, and thanks for taking your seats. I hope everyone enjoyed their lunch and conversations with colleagues and friends. Let's begin our program. First, I want to extend a warm welcome to those joining us online at canadianclub.org. Whether online or in person, our events rely on the support of our sponsors. Today's event is generously supported by the National Bank, Osler's, and Deloitte. Thank you all for your contribution. Also, the Canadian Bankers Association has been a seasoned sponsor this year. We are thankful to Air Canada, our official airline sponsor. Canada's Forest Trust Corporation has partnered with us to help reduce our carbon footprint for the whole season by planting and stewarding a forest in your name. Canadian Club of Toronto regularly invites your leaders, young leaders to join our events, and today we welcome a table from the Toronto Metropolitan University. Where is the table? Before introducing our panelists, I'm going to invite you to think about the questions you may want to ask them. Have your employer health benefits changed over the years? How important are employer health and well-being benefits in your employment decisions? Do employer health benefit plans help you better manage the increased cost of living? Please use the question cards found on your tables, and our volunteers will collect them and have your questions addressed. And for those joining remotely, please hit the Submit a Question button on the right side of your screen, and the question will be picked up by our team here. Now, I'd like to ask Maud LeBlanc, Managing Director and Head, National Bank, to join the podium to introduce our panel today. Maud?
Good afternoon, everyone. I have the pleasure of introducing our panelists for today's discussion. Dave Jones, is the president of Sun Life Health. He's responsible for ensuring Sun Life delivers innovative health solutions to clients and Canadians. Since joining Sun Life 20 years ago, Dave has held progressively senior roles. Most recently, he was Senior Vice President, Group Benefits, leading a dedicated team supporting over 25,000 Canadian employers and their benefit plans. Sherif Habib is the co-founder and CEO of Dialogue Health Technologies, Canada's leading virtual healthcare company. I'm a user, it's fantastic. Launched in 2016, Dialogue offers its integrated health platform to over 6 million Canadians across the country. Dialogue has received several industry accolades, including the Globe and Mail Canada's top growing company in 2003. Before launching Dialogue, Sherif was the CEO of Amcisions, a medical device company. I think I said that correctly, right? Julie Canville is the CEO of the University Health Network Foundation. Her career began first as a journalist in television, radio, and print. In 2003, she was also the Associate Chief of Staff to the Minister of Health and Social Services in Quebec. Julie accepted a senior management role at the McGill University Health Center in 2005 and was appointed president and CEO of its foundation in 2015. Dr. Ash Bender is an occupational psychiatrist and assistant professor with the Faculty of Medicine at the University of Toronto. At CAMH, he's a staff psychiatrist and former medical head of the Work, Stress, and Health program. He has performed numerous independent evaluations for worker compensation, private insurers, employers, unions, regulatory bodies, and the courts. Ash works with the forensic population part-time at the Toronto South Detention Center. And finally, today, the conversation today will be moderated by the Globe and Mail's national health reporter, Carly Weeks. Carly is a respected journalist and one of Canada's leading authority on health-related issues. Thank you.
Merci, Baud, and thank you, Ali, for hosting us today. It's an honor to be introduced by Canada Life and National Bank, two of our most important clients and partners. We're now, of course, part of the Sun Life family, and we're really proud of the fact that several leading insurers who traditionally compete are working with us. Thank you for your trust. I'm also looking forward to hearing from Julie, Ash, and Dave. It's going to be a really interesting discussion. And of course, thank you all for joining us. I sincerely appreciate your interest. Today, I want to cover two topics. Number one, the role of employers in healthcare, both in physical and mental health. And number two, the role of government in supporting healthcare innovation. When we started Dialogue in 2016, we developed a business model based on Canadian values. Patients should never have to pay to see a doctor. This was our first important strategic decision. We simply wanted to help people improve their health and well-being through technology, and this became our mission statement. With my co-founder, Alexi, who's with us here today, we developed a new approach which would increase access to care at no cost to patients or governments. However, as we all know, nothing is free. Someone has to pay. This is where employers like all of you step in. You're increasingly investing in your team's health and well-being. You do it, yes, because it's the right thing to do, but also because it's good for business. Our model leads to new investments in health. This is new money that doesn't come from governments or taxpayers. It's a first in decades. Our lucky lobbyists are the only ones not asking for money. Instead, we're knocking on doors trying to inject new funds into the system. Our initial idea was simply to facilitate access to healthcare through technology, to be able to consult a doctor via a smartphone. This idea evolved over time into what we now call the Integrated Health Platform. What we now have is a holistic virtual clinic that brings together all our programs in one place: primary care, mental health, wellness, and a modern employee assistance program. Combining these programs into an easy-to-use app improves access and outcomes to members. This was our second important strategic decision. Our focus is on members' experience and prevention. This is what drives us, and this is how more than 6 million Canadians have access to our services through partnerships with 50,000 employers of all sizes and in all sectors of the economy, from Bay Street to Main Street. Above all, that's thousands of Canadians who every day don't have to wait in already crowded emergency rooms or clinics, and who can get support for health concerns before they get worse. For employers, the results are clear. For every consultation, there's a 32% ROI. Look, I could share more data, more numbers, but at the end of the day, it's about the patients we help. It's about the young mother whose kid woke up with a scary-looking rash and was seen in minutes by a nurse practitioner early in the morning and got a prescription before going to work. The mother did not miss work, the kid did not miss school, and the point I really want to leave you with is that our services are critical to Canadians and employers are more than happy to support them. You know, when we founded Dialogue, it would have been really easy to charge patients out of pocket for each consultation. And trust me, the demand is there in a very big way. But we strongly believe that healthcare should be available regardless of means. We built Dialogue with a vision to reduce barriers to access great care, and we have worked very hard to make that a reality for all Canadians. Looking back, I can tell you that the decision to focus on employers and insurers was not only the right thing to do, but also the most sustainable for the long term. There are many possible synergies with the public system. In fact, with Sun Life, we sponsored a study demonstrating the benefits of our model. Our report showed that on average, telemedicine platforms like ours save the Canadian healthcare system $52 for each consultation. That is possible because, as you know, we never charge OHIP. This also reduces the pressure on crowded waiting rooms. With roughly 30% of Canadian healthcare being privately funded, we must have the courage as a society to realize that we need to work together and find new ways to offer free, quality care to all Canadians. We need to also be honest with ourselves. If we agree that something is not working, we can't just continue doing the same thing and expect different results. The world has changed since the Canadian Healthcare Act was passed in 1984. At that time, there was no smartphone, barely any internet, and certainly no virtual care. The regulator did not want a doctor to diagnose a patient over a crackling landline halfway across the country without the information they needed to do it safely. But the technology and the practice of medicine have changed. We solved this problem, and we can't apply old regulations to a new reality. We need to stop being dogmatic in healthcare and start being pragmatic. It should not be this hard to promote innovation in health with regulators. The goal is to increase access to quality care for Canadians. The debate shouldn't just be about healthcare funding. We've reached the limits of injecting more taxpayers' money into the system. The debate should be about better use of resources to drive better outcomes for patients. While we argue on funding and the parameters of healthcare delivery, we are not doing what's best for patients. Today, I urge all governments, provincial and federal, to put in place a regulatory framework to encourage employers to offer access to care to their teams. This has been successfully put in place in Quebec and Manitoba, and we hope in many other provinces soon. The fears around what would happen to our healthcare system have not materialized in these provinces, and other provinces must learn from this experience. As I mentioned, 16% of the Canadian population has access to Dialogue. Imagine how much pressure could be relieved from the public system if the entire working population and their families had access to employer-paid virtual care. Look, the reality is I can talk all day about my passion for healthcare innovation, but I think, Carly, you have a few questions for us, so I'll wrap up now. Our services are the best way to improve productivity, reduce absenteeism, and contribute to a healthy workplace. Our model complements the public system and increases access to care for all. Governments should encourage this innovation. In fact, healthy competition improves the quality of our system and overall focus for patients' needs. The public and private sectors have a responsibility to work together, and Canadians expect nothing less from us. This is the future, and we need to embrace it now. Let's not break something that is already working for Canadians. Thank you very much.
Thank you so much for that. Those fantastic remarks, I think, will provide a really good jumping off point for the rest of our discussion. Healthcare has been, I think, at the top of mind for so many of us for many years, and really the pandemic has brought that into huge focus. And, we hear in the media all the time about a new crisis, restricted access, people not being able to get through to a family doctor or nurse practitioner. And so having these other solutions at hand is something that a lot of people are seeking. We're going to be speaking a lot for the rest of this allotted time, just sort of on the need to enhance or reduce any barriers when it comes to employer-based plans. And I thought that maybe, Ash, you might be able to start us off and provide a bit of context. We're coming out of that really horrific pandemic period where, if there was any sort of silver linings, one of them certainly is that I think it really did bring to mind the need for employers to do more and be more flexible and innovative when it comes to providing care for their employees. At the same time, we're faced with the reality of a pharmacare bill that's being, making its way through Parliament, and the changes that could bring. So I'm wondering if you can just start us off by reflecting on some of that.
Well, last year was the busiest year of my life, to be honest, but I think the biggest risk that following the pandemic was essentially a halt of all health services. If you think of all the clinics, all the groups, cognitive behavioral therapy groups that may have been hospital delivered, other services essentially stopped and left a huge cohort of individuals with high needs untreated as well. We've seen this come out in a fallout. We saw it with suicide rates, but now we're also trying desperately to play catch up. It wasn't just inflation with interest rates, it was inflation with mental health issues as well. Out of that really comes an opportunity, I think, to look at innovation. We can't simply deliver our services in a bricks and mortar kind of way, and I really see employers as foundational for adults, just like schools are for children.
Julie, maybe you can talk a little bit about, from your perspective, working inside of the hospital system for so long, and a really unique perspective as well. Sort of, I'm wondering if you can talk a little bit about sort of that employer responsibilities, how that's changing and evolving, and what you think that role should look like.
I obviously can't speak to the employer's perspective, but I can speak from the healthcare perspective. There's a global shortage, there's a manpower global shortage, and we're not going to hire our way out of this crisis. If you think back to when healthcare was created, average expectancy in life was 73. We now have an aging population. We can expect to live to about 86. The world has changed, and we need to all be working united together to find solutions. So I can speak to what we're doing at UHN, which I find to be very innovative, is we have to actually look at the infrastructure and look at the system and look at our partners. And as long as we are respecting the value, the principal value on which healthcare was created, which is that need should dictate access and not capacity, it doesn't prevent the healthcare industry from working with other partners. That is where I would like to say I find the biggest challenge. In Quebec, where I do come from, there was a developing private sector contribution, but it was done in parallel, and it was not planned with the public system. I think that the only way that this is going to work is if we plan it together and we strategize and we integrate the two. There is no point in a patient receiving a referral from Dialogue or another partner if they cannot access the system. And so how do we work together to plan that out?
I think unsurprisingly, so many of the events that I moderate and articles that I've written try to answer some of those basic questions. How do we innovate and get out of some of these barriers. And I think that, while it's so frustrating to see these problems continue, these discussions, the more we have of them will hopefully lead us to a place of change. Dave, that's, I think, a really good place to bring you into the conversation. What are some of the ways in which we can look to reduce some of those barriers to get people better access to the care that they need? Like, what's some of that low-hanging fruit that we could do away with to start to change the system?
Yes, thanks for the question. I think we've heard some great stats and examples, and I think go back to the pandemic, and I think we saw one there that I'd refer to, and I can look forward instead of backward. But during the pandemic, from 2019, pre-pandemic, through to 2022, I don't know what their official dates are, but I'd call mid-pandemic, we saw at Sun, and I think across the employee benefits industry, Canadian employers saw a 70% increase in claims for mental health services. And the way to innovate, the way to pivot, number one, we didn't take that away. Number two, we went online, we went digital, we provided practitioners through apps, through web browsers, with face-to-face contact. Was it perfect? Did everybody get the exact care they needed? Was there continuity? Maybe, maybe not. There's more innovation required. But there's an example where not putting up barriers and letting employers innovate made a huge difference, partly because it helped the 27 million Canadians that have access to that channel, but it also helped all the Canadians that were trying to access a finite resource elsewhere. And I think where we look for examples where we're doing that, where Julie, you said this, where public and private, where the government and employers, insurance companies and Canadians are saying, where does it already work, right? What's the problem? The problem is that not everybody has access. The problem is that people can't get the care they need. So where does it already work? And how do we focus on where the need is the greatest? How do we fill the gaps and make sure, if I use the example, a recent example, a biased example, but a recent example, when the Canadian government set out to bring dental care universally to all Canadians, it didn't say, take the care 27 million people have and throw it out. It said, that works. It's good. We're going to leave employer plans alone. We're going to focus on the 9 million people that don't have this. And we're going to give them a roughly equivalent level of care. And in less than a year, they stood it up. 90,000 Canadians since May 1st have gotten dental care, health care, that they couldn't access before. When everybody in Canada says, yeah, we're going to point our tax dollars and our energy and our resources and our health talent at the people that don't have care, at the people that don't have access to pharmacare, at the people that don't have access to a family doctor, so let's get them virtual care. We can do so much as a country. That's, to me, where we should break down the barriers.
It's a really interesting example, and I think that, it's sometimes, there's so much happening in the world, but I think it's worth just pausing on that and taking note of the fact that the dental care plan really is sort of one of the biggest expansions in sort of public health care, and, since it was created, really, but, it is kind of that hybrid public-private model, right, where it's filling the gaps and meeting the need. Ash, from a clinical perspective, feel free to weigh in on how that dental plan, might be a model for, other aspects of care to the system. But, we know that our mental health care system is anything but, and that, we need to do a lot more to bring care to people when they need it, where they need it. And, if we're in the context of sort of, employer plans, employer-led health, what could that look like in a more enhanced way?
Well, I think the first thing to note with chronic underfunding, it's really relocated services to severe and persistent mental illness as well. Whereas the actual need for most working Canadians is centered around mood, anxiety, substance-related issues. Those are really the big three. And of those, psychology plays an important aspect of that. So increasing access to psychological benefits, I think, is a really important trend over the past 20 years. $300 to upwards to $10,000 in some employers, or unlimited. The other with pharmacare is accessing medications that actually help working Canadians, as opposed to are best suited with people with chronic disability. Those may be very different. So ensuring that whatever benefits you invest to are matched to the groups that are affected. In this case, it's mostly young people. We're talking around millennials and Zoomers, or Gen Z is the biggest group. Do your benefits actually match the needs of your working population?
I'll continue picking on you for another minute before we move on.
No interpretations or Freudian stuff, okay?
Do my best. What do you think, if you had to sort of, make a bit of a report card on where some of those, if you're looking at it from that sort of employer side, where people currently have access. We know that things were enhanced greatly during the pandemic. I know our employer plan certainly was. Mm-hmm. What else could be done sort of right now, or what's some of the things that you're seeing in sort of your clinical day-to-day? We're saying that's something that we should be addressing on a more immediate basis.
The two problem areas, again, is access at the primary care level. I think it leads to unnecessary delay in getting treatment as well. The family doctor is often the quarterback for those issues. The other is the burden around paperwork and requirements for that. If you speak to family, I know Dominic, you're here. I mean, that's at least a quarter of a family doctor's time is spent filling out employer-driven or insurance-driven paperwork, so solutions around that are key. The other is the focus on evidence-based treatments. The initial part with employer assistance programs was offering 4 to 5 sessions of solution-focused psychotherapy. That is not an evidence-based intervention for major depressive disorder, anxiety disorders, or others. So ensuring what you're investing into is actually going to give you health-related incomes as well.
Thank you for that. And Sheriff, I thought maybe, you had spoken about some of the things that Dialogue is doing. I mean, we know that, a big part of the problem is that primary care practitioners are overloaded because everything kind of falls on their plate, from paperwork to just, all different kinds of paperwork to just, trying to manage their day-to-day appointments. What are some of the ways, or maybe even some sort of anecdotal case studies where you're showing that Dialogue is making a meaningful difference in helping to sort of alleviate some of that pressure?
Yeah, thank you for your question. I mean, first of all, 50% of our members or our patients tells us they don't have a family doctor, right? So it's not even that they have one and they don't want to see them, is they don't even have that, right? So that's the first big issue. The second one is that we're able to see a much higher number of patients with the same number of physicians, let's say you compare it to the public healthcare system. And the reason for that is several-fold, but first of all, because we use other professionals. In the public healthcare system, as you know, only the physician's time is reimbursed, so everybody else working in that clinic is really an overhead. In our case, it's not like that, so we have a multidisciplinary team. We have 12 different professionals working for us, and together they work around the patients to get the best outcomes. The second one is technology, right? Having the right technology, the right triage, the right tools for the physicians to spend less time on paperwork and admin time is extremely important. So the combinations of operations and technology, we're able to make a really big dent in the cost and effectiveness of healthcare.
Thank you for that. And there's a couple of audience questions. So this one is for you, Sheriff, and I thought this is actually really great. Your comment that more money is not coming, so innovation is needed. How do we try and bring in sort of industry, sorry, I can't read some of that, but how do we try and sort of bring change to an industry that still faxes into our new tech-based economy or society?
That is an amazing question, whoever asked this, thank you for that. It is hard, right? That is the crux of the problem. As you know, fax is not the only way to send data from one place to the other. And the fact that the regulator insists that it's used, it's kind of an issue, right? I mean, I think in Canada, the regulator sometimes micromanage the details, where really it should say, like, the principle, the spirit is this, and you guys figure out how to send data between two places. And I think that's kind of part of the problem is this, I think we were talking before, and it's a very top-down, micromanaged, centrally planned approach, which I think has now passed its due date. And we need to be more collaborative and bottom up, and the regulator can say, this is the principle, and you guys figure out with all of the intelligence and the brains and the innovation we have in the country, you guys figure out how to respect that principle. So.
Thank you. And Julie, you wanted to jump in?
Yeah, just wanted to add, at UHN, we're investing about $50 million right now to create an AI hub. And we've hired the very first, I think in North America, chief AI scientist to really, he could work anywhere in the world, but he wants to help us develop solutions. And to your point, we have to create these new technologies that reduce the paperwork, that reduce the administrative burden, so that physicians are not spending 40% of their time doing paperwork versus seeing patients. And I'll give you a concrete example. We're in the process of creating a software that actually listens into the patient-physician interaction, summarizes 100% of it, and then actually produces the summarized doctor notes. This is an incredible technology that will not only bring pride, but it will be commercialized and is revolutionizing healthcare. And the other point I'd like to make, which is related to that, is it's time for us to create new professions. And we have a lot of people with medical backgrounds coming from all over the world. They will not recertify as physicians, but there are plenty of other areas that they could support the system and help the physicians spend more time with patients. I'll give you a very concrete example. At one of our hospitals, we do have a homelessness crisis. We have 250 homeless patients who have been 15,000 ER visits per year. So it's a significant number of ER visits. We have now, thanks to a generous donation, we created a peer worker. It is a 6-month training, and they alleviate the pressure on the emergency room in welcoming them and helping them flow through the system. This program has been so successful that now through our Missioner Institute, we are creating a program to be able to train new peer workers to be able to alleviate the system across the country. There are solutions, but we have to use our imagination.
I think those are some really good examples that you raised about just sort of, that outside the box thinking of how can we, we know that we're not going to have enough family doctors overnight or even in the next couple of years, but there's other ways, to address that crisis, and getting away from faxes is certainly one of them. There's another question. You guys are asking some really good ones, so I'm going to go right to the next audience question, and I think this is great, and it's often on top of mind for me. But we're speaking about some really great innovations and ideas. How can we move forward with these innovations when you consider sort of the level of entrenched ideas and unions, sort of union and stakeholder positions? I'm ad-libbing the question a bit, I apologize, but who wants to jump in there first? Ash, and then Dave.
We've done a lot of, I see unions as a really essential part of the workplace system. Partly, we've done projects with Toronto Transit Commission, whereas actually the unions and their partnership is what led to the engagement of the employees and the trust that was really needed for them to participate in health-driven interventions. In this case, we were managing psychological trauma. I've also seen that in a lot of other industries, safety sensitive, where it's a common goal around maintaining the highest employee health, productivity, and the best decision-making. I think if you neglect the unions in this goal, that you're not going to have a successful program, and that they need to be at the table, that leadership, at any project you're bringing through. At the executive end, the health end, the union should be at the table, and I think you'll find the partnership there.
Thank you. Dave?
I strongly agree with that, and I think unions represent people that need access. They need help navigating, they need help affording care. And you take where we're at today and where we've come over the last 10 years, push it out 10 more years, or another 10 years after that, I'd be willing to bet unions are going to be some of the strongest advocates for an ecosystem that allows governments and companies, insurance companies, and people to partner together, because they've always fought for the rights of their membership. How they get there is a different conversation, but I think they're really important voices at the table, and they'll help bring some of what's needed to Canada.
So let's talk a bit more about some of the entrenched ideas, because I think those are some really great perspectives on union involvement. But we know that sometimes innovation does come slowly, especially when you're talking about something that's like the biggest budget item in any provincial or territorial or federal government. I guess when we look at that, there's a number of different things that come to mind. But how do we start to bring about innovation when it is really hard to sort of maybe get everyone on side or have the government say we're going to open up OHIP billing to other healthcare professionals? We saw how quickly things moved during the pandemic. We had virtual care, really overnight, created. How do we extend that in other and different ways to increase access, to make, even integrate places like dialogue into, underserved areas? And I know that's happening, but, scaling that up or making that change. How do we start to do more of that? Who wants to jump in?
Maybe I'll jump in. We already have all of that innovation rolling out. The problem is the lack of budgets. When you look at the way our healthcare system is funded, it's funded with historical budgets, and anytime you want to do something new, you have to add a small amount and you hope that you have the impact. We are, each and every day, we're a powerhouse. I mean, I'll speak obviously from our perspective. You know, this is the #1 publicly funded hospital in the world, and it's sitting right here in our city. It has proven that you can innovate in a publicly funded model, but we have done so because of the generosity of the community. I don't think even 20 years down the line that we can expect the government to be funding that innovation. We have to, ourselves as a group, with our corporate partners and with the generosity of the community, make sure that we invest in that innovation. Now, from a policy perspective, to answer your additional question, where the government can make a difference is, why don't we have investment funds where every time philanthropy or the private sector put in $1, why can't the government match it? And I'm looking at both the innovation within healthcare, but also from a commercialization perspective. We have historically numerous times, and I'm so happy to see dialogue remain in Canada, but we have historically sold off all of our discoveries and innovations for almost nothing to the Americans and bought back products. We can do better, but we're going to need some help.
I'll push back on one point. I'd be interested to hear your thoughts. Because we often hear, we've heard this from, remember the finance minister saying this, and from all the way on, down the line, that we're spending more on healthcare than we ever have, and yet our outcomes are not proving better. In fact, in many cases, they're proving worse. So I'm sure you have an answer for that, and I'd love to hear it.
We are, and this is third-party evaluation at UHN, we are considered the #1 publicly funded hospital. I think where the problem is on access. When you are in the system, we have some of the best physicians and nurses from all around the world. Our access is the problem, and you look at the aging population and the growing population, it is not a surprise. So I think we have to start looking at what we're doing really well, and we have to scale it up.
Thank you for that. And a quick pause to say, I just wanted to emphasize the work of healthcare professionals and the work that they're doing. They're real healthcare heroes, and it's been a long time since the start of the pandemic. There's been so much harassment and abuse lobbed the way of hardworking healthcare professionals, but they really are doing such amazing work across the country. Yeah, and then jump in. And Dave, you wanted to jump in?
Yeah, I want to jump in on the outcomes one. So I disagree that we aren't seeing better outcomes. We may, at a macro system level, be seeing that due to silos, due to navigational issues, due to access issues. Getting the right care to the right people in the right place at the right time. But I'll just give Sharif could give amazing examples, I think, of better outcomes from the primary care they provided, because they're providing primary care before issues escalate, the same day it's needed, to the person who needs it, and they're directing people to their family physician where they need continuity of care if they have a family physician, to hospitals when it's urgent. Another example, and this to me is a great example of private innovation, it's a little self-serving because it's about Sun Life, but nonetheless, we are taking an approach, and we've got our first one of these. I'd love to have a dozen of these, and we'll get there. Health journeys, and we help a person navigate across the silos. So we put in place late last year, early this year, a diabetes journey, where we're taking the best of virtual care for primary care, virtual mental health care, a virtual dietitian, a virtual pharmacist, the ability to bring your diabetes medication and supplies and everything to your house, and then even connecting you to virtual group coaching and getting you into in-person care if you need it. These are early days and low numbers. Of the first 1,000 people that went through that, 100% of them improved, had better outcomes. 70% of them are contemplating demedication, lowering their levels of medication utilization. So I disagree that there aren't better outcomes. I think that at a macro level, it's hard to solve the micro problem of navigation, access, and affordability. But when you let the best of the public and the private work together, which our diabetes journey does, you can get phenomenally improved outcomes.
Thank you for that. That's a really important perspective. There's a couple of more audience questions before we wrap up. We are kind of coming toward the end. I don't know if Julie, this might be one for you, or whoever wants to jump in. But one of the sort of issues raised is that we have a large cohort of new immigrants who are needing healthcare, and their languages may not be French or English. So how we can use AI to help connect those people to care, to kind of get them the appropriate care that they need sort of in real time.
Yeah, when someone is sick, it's not the time for a language test. And so we have to provide them with information in their language. And so we provide it in just about every language that you can think of. And that's really crucial. And when you're explaining what the next steps are and what they're being diagnosed with. AI, is probably going to replace about 25% of what we do in healthcare. These are tools. They won't replace the interaction between healthcare providers and patients, but they're going to facilitate and they're going to reduce the burden. So I think it's extremely exciting, and yes, absolutely, it is already. We are already using AI for that, and it will only get better and easier in the future.
Carly, if I think one of the key parts also, Metropolitan University, for example, opened up a medical school whose primary directive is to train individuals who represent the diversity of Canada. Because we know that individuals are much more likely to seek out care providers who speak their language and understand their culture. And as we diversify, I think that's an essential part from our healthcare delivery, is make sure and that's reflected in healthcare providers, not just within workplace settings as well. And I think that'll significantly improve outcomes as well. So anything to support that is welcome.
Mm-hmm. Thank you.
Can I make a quick comment on that?
Yeah, please.
So last Friday night, I had to bring my 3-year-old to the ER because he cut his ear, and on the intercom, it says, "Is there an Arabic interpreter, room 7?" And I'm not an interpreter, so I didn't respond. And then after 3 times, I went up to room 7. I said, "I'm not an interpreter, but maybe I can help." And whatever, couple of exchanges, and then the patient left the room, and I showed the nurse on my phone the ChatGPT app, and I said, like, you could do this. You can ask it and say, translate in Arabic. And she was blown away. Like, this technology is here today, available to everybody, available to every phone. This is not some new thing. So just that education and just showing that people can use it, I think, can have a huge impact.
That is really amazing. And it's good to have sort of inject some hope into what often feels like a hopeless conversation around health. Before we end, I wanted perhaps each of you to weigh in. Maybe we can start from you, Sharif, and move our way back down the line. If we could change sort of one thing, keeping in mind we have like 5 minutes, less than 5 minutes, if you could sort of change 1 or 2 things and kind of look to the future, how is our system functioning better? What are we doing? The top line priorities of getting things done to make access better, to make care easier.
For me, it's very simple, and I said it in my remarks. I think just being practical and pragmatic. I think a lot of our conversations are dogmatic, bordering on religious, right? Let's just be pragmatic, and let's just think what's best for the patient and do that. And I think just that is very simple, and I think will yield very good results.
I mean, my initiative is really to train physicians around disability prevention and understanding how to take on a rehabilitation-focused treatment model rather than what they're traditionally trained in as chronic disease management. And I think that's going to better serve our younger and more diverse working population.
Thank you.
So we've merged with the Michener Institute, the only academic institution in the country funded by health, to try and create, control the pipeline of new professionals, but also create new professions. So that's one. And the second one, I loved what I heard from my colleague here. I hope that we can all work together on prevention. And you cannot have a quality of health if you do not address the issues of the social determinants of health. And how can we work together to really invest in prevention?
Mm-hmm. Definitely.
I feel a lot of pressure with the last one here, Charlie. So I'm going to go back to moving from dogmatic to pragmatic. And I think, from my perspective, if we could all agree that as Canadians we hold dear that we want every Canadian, regardless of where they are, who they are, how much they earn, how much they have, to be able to access what they need to live their healthiest life. If we can all agree on that, and then reframe how we put that into practice in Canada, so that we fill the gaps. We find the people that don't have care and coverage and we get it to them somehow. Public is great. If public can't step in, work with employers, work with companies, work with individuals, but reframe it that way so we can move away from an old dogmatic conversation that's not relevant in a resource-constrained world and move to a place where every Canadian can actually access, navigate, and afford care. That would be my absolute ideal nirvana.
And a quick follow-up, how do we get there? What's the best path forward?
Dial. No.
Yeah, there we go.
Clearly Sun Life and Dialogue. No, I think the way we get there, and you started the conversation off with pharmacare. Like, let's reframe pharmacare. Let's not pay out of all of our tax dollars for medicines for 27 million people that already have it. Let's not help the person who's trying to deal with their appointment they've had with Dr. Bender by saying, good news, I'll pay for your contraception, when that's not what they need, but not pay for what they do need. Let's let the public purse help that person because they don't have coverage. Take what we've got that works, save fixing that for a rainy day, fill the gaps by bringing coverage to people who need coverage.
So a lot like the dental plan.
That would be a great starting point.
That's great. Well, I really thank you, all of you, for making time today and having this really important discussion, to the Canadian Club of Toronto for having all of us, and for all of you for being here and being part of this really dynamic discussion. It's been a really wonderful hour and a half.
Yeah.
Thank you.
Great, thank you.
Roughly an hour and a half.
On behalf of the Canadian Club of Toronto, I want to thank Dave, Sharif, Julie, and Ash for providing an insightful overview of the dynamic ecosystem of Canadian healthcare, employer benefits, and the growing importance of maintaining physical and mental health in our workplaces and in our society. We appreciate all that you do through your leadership roles to advance health and well-being for Canadians. Please accept our best wishes for continued success. And Carly, thank you for your engaging and expert moderation skills. We are deeply appreciative, so thanks. Before today's event draws to a close, I encourage you to attend June's rich lineup of events, including a reconciliation on Bay Street conversation on June 5th, Scotiabank's President and CEO, Scott Thompson, on June 6th. We're presenting our Lifetime Achievement Award to Peter Gilligan of Mattamy Homes on June 10th. And on June 13th, we welcome the Honorable Seamus O'Regan, Minister of Labor and Senior Citizens. Please visit our website for more event information and to purchase your tickets. Let me conclude by thanking our AV supplier, VVC Live, for supporting the success of our events. And one more thanks to National Club, Ostlers, and Deloitte for supporting today's important conversation. Members and guests, thanks for being with us today. Enjoy the rest of your afternoon. Thank you.